My name is Dr. Michelle Paul. I own the Allentown Cat Clinic, and I've been a cat-only veterinarian for 20 years. Today we're here to go through a cat physical exam with you, show you what we're doing. We're not just petting the kitty, we are looking for certain things. So we have Spud here. Spud's a 9-year-old domestic shorthair. He is owned by one of our employees here, and I have Sarah here helping me hold him. So I go through and I start from the head and I work my way back to the tail. So the first thing that I'm going to do is make friends with Spud. Hi Spud, how are you doing? And I'm going to peek in his ears. And what I'm looking for is, are they clean in there? Do I see wax? Could there be ear mites? So his ears look clean. If they didn't, I would stick a Q-tip in there and I would take the sample of whatever I get out and look at it on our microscope and see if there's wax or ear mites or an infection. And then I look at his eyes. In Spud's case, he only has one. He lost his eye when he was a youngster. So his eyes look good, his pupil looks normal, the color looks right, there's no swelling, there's no drainage. His nose looks good, there's no drainage there. And now I'm going to look at his teeth. These are a nice set of choppers here. Spud broke his canine tooth at some point. And I'm also going to look at his throat and his tongue and just make sure that there's no sign of tartar, no sign of gingivitis, no infected teeth, and that his tongue and the back of his throat look good. And they can get sore throats just like we do. So then you'll see look like I'm petting this kitty here. But what I'm really doing is feeling down his neck. They have lymph nodes right here like we do that can get swollen if they get a sore throat. Thyroid conditions can be felt if you run your fingers down the neck. You can feel an enlarged thyroid. We do know that Spud does have an overactive thyroid, but I do not feel his thyroid gland when I run my fingers down him. So then I proceed to the chest. I'm going to listen to his heart and lungs. I want to make sure that the heart rate is normal, that his heart rhythm is normal, that he's not throwing in extra beats. I'm going to listen to his lungs, make sure that they sound normal, that I'm not hearing wheezing like an asthmatic. Normal cat heart rate in an exam room runs a little faster than at home. I would expect him to be running anywhere from 140 to 200 beats a minute. Anything beyond that's a little bit too fast. So I'm going to take a listen to Spud here. Spud's heart rate right now is about 180, which is perfectly fine for an exam room. Everything sounds normal. And then from there I proceed to touch him all over the place. I'm going to run my hands down his front legs, all over his body, and I'm looking for any skin lumps, any lumps underneath the skin. I'm going to start feeling his abdomen here. Cats are a really fascinating animal. You can actually feel their kidneys, and I actually have his kidneys in my hands right now. I can rub my hands right through his intestinal tract and feel if they're swollen, if the lymph nodes in the middle of the abdomen are swollen. I can feel his bladder. So we look like we're just petting the kitty, but we really are checking different things out on him. I can feel along his spine and see if he's lost any weight. If they lose weight because they're sick, they've lost muscle along here, and you can feel the spine start to protrude. I can even feel if he has some arthritis in his knees and his hips, which he does a little bit. And then I'm going to get a little bit rude here and peek under his tail, look at his back end. So everything looks good on Spud. And then next, we want to check his weight. I want to make sure that he's not losing weight. In an older cat like Spud, the first sign that there's a problem is that they start to lose weight. He's 11 pounds, 6 ounces, very nice. And then I'll check that against last year's and see if it compares, you know, has he gone up, has he gone down? With a thyroid condition, I do worry that he loses weight. So then from here, I'm going to update him on his vaccines, and we're going to take him to the treatment room to have blood drawn because I know he has a thyroid condition, so we're going to run some blood work on him. But that's basically what a physical exam on a cat entails. I hope you enjoyed this, and thank you for joining us. Bye.